And we're heading off to the Health Hub Times Square in Ballincollig, where Anneliese Dressel joins me on what is a lovely sunny afternoon at the moment. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
Have you nice winter sunshine in Ballincollig?
Yeah, absolutely glorious.
It's really
is.
Yeah, it's great.
Oh, it's cheering, isn't it?
It
like
is.
That blue sky is just... And we're lucky, actually. I know we've had a big storm, Patricia, but last year I walk in the mornings before work, and every day I was in my wellies and raincoat, and actually we've had a reasonably dry spell of it this year, I think.
Yeah, and we had that lovely mild spell as well, so we can't complain for sure. Okay, let's get straight into questions for Anneliese, please. Hi, Patricia. Could you ask Anneliese? I had to have a CT scan, and I've been told I have slightly fatty liver. Now, I do accept and know my diet must change, but are there any supplements that Anneliese would suggest that might help?
Yes, so that's actually becoming very common, Patricia. And previously, when people thought of fatty liver, they thought mostly about alcoholics and over drinking too much alcohol, because the alcohol was being converted to fat and stored in the liver. But actually, it's happening now as a result of our Western diet. So it's because of the very high sugary and carbohydrate diet that we have in the West, and a lot of the products that we eat, the food products, the processed ones, they've added to them the high fructose corn syrup, and that's really driving fatty liver. So we're starting to see an awful lot of it amongst people who really don't barely drink at all. So in terms of diet, the best diet really is to cut down hugely on your carbohydrates, which means your bread and pasta, rice, potatoes, and definitely all biscuits and cakes, sugary foods and sugary treats, anything like that. Now, that sounds quite extreme, so if that's too much for you, just switch over your carbohydrates to the brown variety. So you should be having brown rice, brown pasta, brown bread. Stay away from anything white, and stay away from sugary drinks, even those Coca-Colas that have the artificial sweetener in there. There is a link there with fatty liver as well. So avoid all of those fizzy drinks. And then in terms of supplements, always one of the best supplements for the liver is something called milk thistle, because it helps the cells of the liver to regenerate. So definitely that should be one of them. Then there's another one called berberine, and this is a really, actually, a lot of people have berberis plant in their garden. It's that beautiful purple sort of disc-shaped plant in shrub in people's gardens. But berberine is brilliant for improving insulin resistance, and what that means is sugar is taken from your blood and brought into your cells where it's used for energy. If that doesn't happen efficiently, that glucose ends up being stored as fat in your liver. So blood sugar and insulin resistance are very important for this. So I would do a combination of both the berberine and the milk thistle. And also there is another one that is lovely if you're further down the line than the very early stages, called alpha-lipoic acid. And that's another big protective one for the liver. So a combination of the three of those, and do that for 3 or 4 months with your diet, and go back and get rechecked, and all of your liver enzymes and everything should be coming down at that stage.
Okay, Helen says, hi Patricia, I recently had pneumonia. Now, despite 2 courses of antibiotics and I had to go on steroids, I still have a dreadful cough. It seems to be with me constantly. Any advice on how to get rid of it from Anneliese?
Okay, so to know, is it a dry cough, or if it is a productive cough, which is what they call it when there's a lot of mucus. So if it's a dry cough, obviously there's still a lot of irritation of the tissues. But then if there is mucus, that is more, that your body is still producing mucus in terms of fighting a virus, or as a result of inflammation and irritation. So if it's a dry cough, what I would recommend is it's Comvita Manuka Honey Elixir, and it is a lovely blend of different things that are really, really soothing, and you could take that. The way they instruct people to take this is 2 teaspoons, I think 3 times a day. The way I take this when I'm taking it is, if I start coughing, I take it then a little bit. I'd even just take a sip out of the bottle, and I let it kind of trickle down my throat, and it's very, very, very soothing. It stops you going into those awful coughing fits. So that's the Comvita Manuka Honey Elixir. Also, something called mullein is very good. Dr. Dealish Clare, she does a clear away tea, which is mullein and marshmallow in there, and it's very good to nourish the tissue of the lungs, which would be very good for somebody after pneumonia. So that's the Dr. Clare Clear Away Tea. And then the last thing I would say, that if it is mucusy, I would go with the Dr. Clare Mucotone. So that is a herbal blend that is you take in from a spoon, and there's herbs in there to boost the immune system, antiviral, herbs to nourish the lungs, and herbs to kind of help with mucus and thin and dry up mucus. So either of any of those, depending on what type of cough you have.
Okay, Liz wants to know, is it okay to take cod liver oil with vitamin C while on a cholesterol tablet?
Yes, definitely. In fact, it would be very, very good to take with the cholesterol tablet, because cod liver oil is very high in EPA, which is a natural anti-inflammatory, so very good for heart health in that way, and very high in DHA, which is an essential component of kind of brain tissue and other tissues. So it'll help increase your good cholesterol, and it'll also protect brain and heart from any potential side effects of the statin drug as well. And a vitamin C, of course. Vitamin C is great, and it's one of the ones you can take in a high dose, because what your body won't use, it'll just get rid of, it'll just wee out. So it's safe to take in high doses and lovely for skin, bones and the immune system.
Okay, Anne says, would you get dizzy now and again if your iron levels were low? Anne also wants to know, what does B12 vitamin do for your system?
Okay, so yes, the answer to the first bit is yes, if you were low in iron, you would get dizzy. But if you were also low in B12, you could get dizzy, and even folate, because the three of these things are very, very important to make your red blood cells. And red blood cells carry oxygen around to all of the cells in your body. So if you're deficient in any of those, you would be feeling very tired, because all of your cells are not getting the oxygen that they need to be able to do their job and function, and you could definitely get very dizzy. So B12 is also involved in nervous system function, but the big one we know it for is for that energy, because a deficiency causes anemia, lack of red